Okay, hi, Assalamualaikum to my lecturer, Dr. Zulkarnain, and all my friends. So today we would like to present in our part, which is a spine injuries. Okay, my name is Afika binti Zulani. I am the first presenter, and my group members is Nurhayani, Muhammad Izzuddin, Muhammad Iqmal, and Sashdati. Okay, now I will present in my parts, which is the anatomy of spine injuries. Okay, spine is the vertebral column that has 33 bones that called a vertebra, and also separate by the intervertebral disc. Next is the column is divided into 5 different vertebral structure, which is the cervical vertebra, thoracic vertebra, lumbar vertebra, sacrum and coccyx. And also spine have a function, which is first it can protect the spinal cord within the spinal canal, and also as a support it can carry the weight of the body above the pelvis. Next, it also can form the central axis of the body, and lastly it can help in posture and movement of the body. For example, in the cervical vertebra, we have a C1 and C2, which is atlas and axis, that the function can allow the movement of the head. Okay, next is classification of the vertebra. Have a 5 classification of vertebra, which is the first is cervical vertebra. Okay, cervical vertebra has 7 spinal column, which is C1 until C7, but in cervical vertebra has a unique and a special spike, which is C1 and C2. C1 is atlas and C2 is axis, and their function is can allow for the movement of the head. Okay, next is thoracic vertebra. Okay, for thoracic vertebra, it have a 12 spinal column, which is T1 until T12. And thoracic vertebra is a medium size, and the size it will increase. The size it will increase from the superior until from the superior to the inferior. So the size it will increase. And their specialized function is to articulate with ribs and producing the bony thorax. Okay, the third is the lumbar vertebra. Okay, for lumbar vertebra has a 5 spinal column, which is L1 until L5, and it has the largest in the vertebral column. And also their specialized function is to support the weight of the torso. Okay, next is the sacrum. Okay, sacrum a wedge-shaped bone that is below the 5 lumbar vertebra at the base of our spine. Sacrum actually is the large and have a flat triangular shaped bone rested between the hip bone. So sacrum located at the middle of the hip bone. Okay, and then lastly is coccyx. Coccyx has a 3 part, but from the 3 part has a 1 part that can support for a person in the sit position, and coccyx is a small bone which articulate with the apex of the sacrum. So coccyx also is known as a tailbone and located at the below of the sacrum. So lastly, this is the example of our spine. So from the cervical, we have C1 until C7, and next is thoracic, which is T1 until T12. Next is lumbar, L1 until L5, and has a sacrum. And also lastly, the smallest part in our spine is coccyx. Okay, so that's all from me. Thank you.
Hi, Assalamualaikum to Dr. Zulkarnain and my friends. My name is Nurhaini binti Nur Azhar. I am from class RSR 2433A. So I am the second presenter for the spine injury group. Today, I will present about the common spine injury in sport. As we know, all sports-related injuries are serious, but not more so than those related to the spine. The first common spine injury in sport is cervical neck stingers. Stingers are usually occur in contact or collision sports. When an athlete's head is forced back and or to the side, the cervical nerves can compress or overstretch, which causes pain that radiates through one of the arms. Injured athletes describe this pain as an electric shock that lasts from anywhere between a few seconds to minutes. As we can see in this picture, this is the mechanism of injury for a cervical neck stingers. The common sport that related to these cervical neck stingers injuries is rugby. Next is vertebral stress fractures. Repetitive twisting and turning and extending movements place a tremendous amount of stress on the spinal vertebrae. An overloaded spine is prone to sustain tiny vertebral cracks known as stress fractures. These fractures are most common in golfers, gymnasts, cheerleaders, dancers, divers, and volleyball players. This is the illustration for vertebral stress fractures. The common vertebral stress fracture symptoms are pain, swelling, and bruising. This is an example of gymnast athlete who had a vertebral stress fractures injury. Next, the common spine injury in sport is lower back strains and sprains. The back strain is an injury to either a muscle or tendon, while a back sprain is the stretching or tearing of a ligament. Twisting or pulling a muscle or tendon can result in a strain. It can also be caused by a single instance for improper lifting or by overstressing the back muscles, while a sprain often occurs after a fall or sudden twist or a blow to the body that forces a joint out of its normal positions. These lower back strains and sprains injuries are most common in golfers, weightlifters, and gymnasts. These lower back muscle strains and ligament sprains can limit the athletic performance. The symptoms include pain, swelling, bruising, and weakness. Next is the vertebral disc injuries. These vertebral disc injuries are common in golf sports. This is because a golfer's setup requires an excessive amount of spinal flexion. On the backswing, the flexed spine is loaded, which puts pressure on the disc and makes them susceptible to injury. The two most common types of injuries are a bulging disc and a herniated disc. A bulging disc is a portion is a portion of the disc protrudes into the spinal canal. The spinal cord may or may not be pinched. The symptoms may or may not occur, while a herniated disc is the outer ring of the disc protrudes into the spinal canal. The spinal cord is usually pinched. Symptoms of pain, burning, numbness, and weakness are usually occur. That's all from me. Thank you.
Assalamualaikum, my name is Muhammad bin Yusuf. The next presenter I want to continue yang ni part is common spine injury. The next is spine injury is degenerative disease. Degenerative disease become more prevalent with age and is defined by deterioration. The disc located between the vertebrae break down with use and functionality in the back is compromised. The discs lose their shock absorbing ability and normal flexing and bending of the back become problematic. Nearly everyone's spinal disc shows signs of wear as the age. Not everyone, however, will have the degenerative disc disease. Not actually a disease, this is a condition in which the damaged disc causes pain. A wide range of symptoms and severity is associated with this condition. The causes degenerative disease is several factors. The first, I give the drying up of disc. When we are born, the disc is about 80% water. As we age, the disc dry out. The doesn't absorb shock as well. The second factor is injuries which can cause swelling, soreness, and instability. This can result in a low back pain. The next, the next injury is bulging disc. Bulging disc, in addition to herniated and the degenerative disc, bulging discs are also painful as they cause undue pressure on nerve. Your spine consists of vertebrae which have spinal discs in between to act as a shock absorber, preventing damage to the spinal tissue and a bone. Uh, as they causes the pressure on the nerve, pressure can also be passed onto the spinal cord. The condition can be age-related, but people with poor posture, especially when the lifting of heavy object, are also susceptible. Bulging discs are one of the conditions for which you're being taught to lift with your leg and not with your back. A bulging disc can also be a result of a trauma, and a condition could even be a passed down hereditary. The next is the equipment for strapping. First, kinesiology tape. Second, strapping tape and scissors.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Izzuddin bin Nizam. I am going to show the procedure of taping, strapping and kinesiotaping for spine injury. Begin with a white strip. Remove the backing on the white strip. And apply the base near the C7 area without any tension. Remove the backing on each tail. Apply the tape to each side of the neck with 25 to 50% tension but ends with no tension. Start a banded tear on the eye strip. Then apply it directly over C7 with 50% tension and end without any tension. Gently rub the tip to activate the adhesive. Bend upper body forward so lower back is round. Measure the length from the buttocks to the middle of the back. Double this length. Cut off the tape and round off the ends. Tear the paper of 3 to 4 cm from both ends and remove the middle piece of paper. Place the tape on the side of the spine without tension and tap it lightly. Remove the paper from both ends and rub the tape without any tension. Then, place the second tape on the other side of the spine in the same way. Now, you need 3 tape strips. Measure the length from the spine to the side of the lower back. Tear the paper of 3 to 4 cm from both ends and remove the middle piece of paper. Stick on the strip horizontally for about 80% tension about the beginning of the buttocks. Stick the ends of the tape without tension. Then, take the second strip, place it clockwise from the spine with the same tension as previous tape. For the last tape, place it anti-clockwise from the spine with the same tension. To finish the application, rub the tape to activate adhesive. When the patient stands up, the typical wave or wrinkle form at the tape and become visible. Bend forward a little bit. Find the area where the patient feels the pain or discomfort. Tear the paper of 3 to 4 cm from both ends. And apply tape with 100% of stretch at the pain or discomfort area and no stretch on the ends. Next, the second piece of tape we put either side of the spine with 0% stretch. For the last tape, follow the previous step for the left side of the spine with 0% stretch. Rub the tape to activate adhesive. Flex the patient suggested to place hand to stabilize the back and rotate to the left side bend. Peel the tape at the end. Apply at the pain area. Stretch the tape 25 to 50% tension across the lumbar spine. Next, place the tape a little bit higher. And apply the same tension as previous tape. For the third tape, apply 50 to 75% stretch across the area of the pain. And the same, apply the last tape with a slight gap between the third tape with 50 to 75% tension across the pain area. Once you done the tape, then use the back of the tape just to hit activate for a better stick. Flex a little bit and just round your shoulder. Apply first tape around C7 or T1 area, so directly through the mid-scapular region. About 10% stretch. Apply the second tape, same as the right side. With 10% stretch. Then, apply the next tape where the pain is located horizontally from the left scapula to the next scapula. With 75% stretch and no stretch on the ends. Again, repeat the same step but apply on the lower part of the scapula. With 75% stretch. Use the back of the tape just to hit activate. Bend over until relaxed position to stretch the skin. Apply first piece of tape at the base of the neck. Pull 80%, stretch straight down the spine. Apply second piece at the base of the neck as well, which is neck to the first tape. Stretch 80%, come down alongside and follow the shoulder blade. Apply the third tape, same as the left side. Stretch 80%, come down and follow the shoulder blade. Make sure the tape is adhered to the skin.
Assalamualaikum warahmatullahi wabarakatuh. My name is Sajdati binti Rosli. So I will continue the slide presentation for do and don'ts for spine injury. If you have spine injury, you have to do regular stretching exercise. This stretching exercise will help you to reduce your pains, no matter how much you hurt. But if you can get to continue for stretching, you better stop it. The exercise that you can do is like yoga and tai chi. Second, do get regular chiropractic massage. Massage is the most enjoyable things that you can do for your back. The doctor will assess your injury and take a look at your spine to see if there are any joint dysfunction or restriction that may have played a part in the injury. It can help you to get your normal activities back. Third, do pay attention for your posture. A good posture can avoid you from having back pain. Fourth, sleep on your side. Put a pillow between your knees to give support and stop your back twisting. 5. Do apply ice. If you feel twitch, you have to get an ice pack on that affected area as soon as you can. The ice will help you to reduce inflammation and control your pain. Put the ice about 20 minutes at a time for 2 to 3 days a day. For don't sleep on your stomach. This can worsen your back pain. This position will put the most amount of pressure on your neck and can cause constant head and neck pain. Second, don't look down at hours at a time. If you're sitting down, your lower back can bring havoc on your neck. If you're looking down at cell phone or reading, you have to take a break. Stretch your neck and back at least every 30 minutes. Third, don't sit for a long period of time. You have to move your body for every 30 minutes to help you to prevent from injury. Fourth, don't perform certain activities that can make you more pain. You should avoid exercise like running, lifting weight, and sit-up because it can cause your more back pain. 5. Don't carry heavy objects such as a backpack because it will make your lower back more pain. So for the conclusion, there are many causes that can affect the development of spinal cord injury. When the spinal cord is injured, your brain can communicate properly, and so sensation and movement will be impaired. Serious complication will result. Quadriplegia and paraplegia are not managed carefully. Exercise is a great way for most individuals with spinal cord injury to improve their overall health and ability to do everyday activities. Okay, that's all from me. That's all from us. Thank you.